The first topic was insomnia. Dr. Oz partnered with the New York Sleep Disorders Institute and sleep experts from around the country. They answered calls for people's questions and tested some people in person. Some people were going to bed too early. The doctor said people need about 7 hours of sleep each night, and if you sleep less than 5, you need to get help from your doctor. Lack of sleep makes people at risk of heart disease, diabetes, obesity, depression and anxiety, hypertension, heart attack, and other issues. Dr. Michael Breus said people who have trouble sleeping need to think about sleep as soon as they wake up to create better habits. He said falling asleep should only take about 10 to 20 minutes. Oz recommended an omega-3 rich meal in the morning to an audience member, and she said it helped a lot after about 2 weeks. Breus recommended oatmeal, walnuts, chia, and flax seeds because omega-3s help with production of melatonin so you don't have to supplement. They help to fall asleep and stay asleep. Oz suggested not having caffeine after noon. Breus said people with insomnia have higher core body temperatures, and the bedroom temperature should be 65 to 67 degrees. Breus said pills should be a short-term solution and can have significant side effects, especially with even 1 glass of alcohol, and they only extend sleep by about 15 minutes. Breus suggested progressive muscle relaxation instead. He said to raise the eyebrows as high as you can for 6 seconds, then squint your eyes as hard as you can for 6 seconds, then progressively tense and release the rest of the muscles the rest of the way down your body. Don't have a TV or phone on during hours you should be sleeping. There's a full sleep action plan on droz.com, and you can tweet to hashtag #DrOzSleepClinic. Then Oz talked about the death of Joan Rivers. His guest, Dr. Jonathan Aviv, an ear, nose, and throat specialist and pioneer in the use of endoscopy, said Joan's endoscopy should have been done in a hospital and not an outpatient facility. Other names for outpatient facilities are day surgery centers, ambulatory surgery centers, medical clinics, and endoscopy centers. About 70% of surgeries are being done in outpatient facilities. Aviv said make sure the facility is licensed in that state and affiliated with the hospital. There's a calculator at droz.com to check your risk of a heart attack to let you know if you should have a procedure at a hospital instead of an outpatient facility. Aviv said advanced age is a risk of complications from anesthesia, and 75 is about the age you should get anesthesia in a hospital instead. It's okay to ask your doctor if you should have a procedure in a hospital instead or if there are alternative procedures. He said there is an alternative to endoscopy called TNE, which stands for transnasal esophagoscopy, which goes through the nose instead of the mouth and avoids the gag reflex and doesn't require sedation. This is good for people with heartburn and throat burn. The next subject was kidney stones. Oz said 1 in 11 people will develop them in their lifetime. They are caused by dehydration. They're small rocks, mostly made of calcium. He said urine should be almost clear, so drink plenty of water. Citrate also helps, and you can get it from fruits like lemons, including unsweetened lemonade. You can download the Ask MD app to diagnose symptoms of many things, including kidney stones. Next, Oz discussed lack of energy. Oz said people need 25 grams of fiber and 46 grams of protein per day, and they help stabilize blood sugar levels. He suggested rice cakes with almond butter and pumpkin seeds on top, or a cottage cheese parfait with pears and cinnamon on top because cinnamon calms the sugar's effect on the body. He said if you don't have time to eat healthily, you can chew gum because it may increase the heart rate. He said peppermint increases alertness by 10%. A viewer on Twitter said drinking water helps give her more energy, and there are more energy boosters on droz.com. Then Oz talked to bullying victim Brandon Bowen of the Blocking Out the Haters video, who got an infection at age 13 that left him unable to walk for a year, and he gained 50 pounds and was mercilessly teased for his appearance. Instead of being depressed, he posted positive videos and says being positive makes life happier.